Valium is a drug that has been used since the 1970s. It is also known as diazepam. Most people know of Valium as a drug used during the surgical removal of wisdom teeth. However, Valium has a lot more uses and it can be easily abused, which leads to dangerous consequences. Psychiatric drugs started production in 1950 after the creation of a drug called chlorpromazine, CPZ, which is now known as Thorazine. There was widespread use of CPZ in 1959 due to the demand in psychiatric hospitals for acute disorders. It wasn't until 1970 that Valium was created through the use of Thorazine's chemical makeup. Ever since its creation, Valium has become the most frequently prescribed drug in the past 40 years. Valium is considered an improvement from barbiturates since it's less dangerous and less physically addictive, although with long-term use, a person can get physically addicted. Valium is now prescribed to treat the effects of anxiety disorders, such as muscle spasms, anxiety, seizures, and agitation associated with alcohol withdrawal. While the drug cannot cure anxiety, it can relieve the symptoms of mental illness. However, it does wear off, and the user must take another dose for the same effect. Valium has been known to help with insomnia, irritable bowel syndrome, panic attacks, certain types of epilepsy, and of course the removal of wisdom teeth.
Valium is in the pregnancy category. It is also a Category D drug. It is an anti-anxiety agent, anti-convulsant sedative, hypnotic, and skeletal muscle relaxant. In a pharmaceutical setting, it is a benzodiazepines, which is any of the class of organic compounds used in a tranquilizer. Valium is also a Class 4 drug. The drug has low potential for abuse relative to the drugs in Class 3. The drug has a currently accepted medical use in treatment in the United States. Abuse of the drug has led to limited physical dependence or psychological dependence relative to the drugs in Class 3.
Valium is most often administered in order for a person to achieve relief from anxiety, depression, and seizures. The drug works in the brain and spinal cord in order to produce a calming effect and to enhance certain natural chemicals in the body. However, these positive effects only work in small doses. Once an individual starts to abuse the drug and uses it long-term, it can cause clumsiness and an inability to perform physical activities, aggression and violent behaviors, mood swings and depression, problems with memory and concentration, slowed respiration and reduced blood pressure, lethargy, lack of motivation, irritation, fever, rapid heart rate, stomach cramps, as well as increased depression, seizures, and anxiety. If an individual continues to use Valium longer than they are prescribed to, they increase their risk of addiction and accidental overdose as a result of the drug.
Due to the psychological and physical properties of the drug, there is a high likelihood that someone will get addicted to Valium. Addiction to this class of drugs can be the hardest to break because Valium induces a false sense of well-being and relaxation. There are many factors that can influence addiction. A person is at higher risk if someone in their family has a history of addiction. Also, brain chemistry influences addiction level because Valium enhances the GABA receptors and decreases the amount of serotonin in your brain. Someone may use more or less depending on their levels of chemicals in their brain. The environment can also have an effect. For example, if someone is in a stressful environment, they may be more inclined to take Valium to decrease their anxiety. There are psychological factors that also increase a user's risk of addiction. Many people who get addicted to other substances take Valium to enhance positive effects or decrease negative effects of the second drug. Due to the psychological and physical properties of the drug, there is a high likelihood that someone will get addicted to Valium. Addiction to this class of drugs can be the hardest to break because Valium induces a false sense of well-being and relaxation. There are many factors that can influence addiction. A person is at higher risk if someone in their family has a history of addiction. Also, brain chemistry influences addiction level because Valium enhances the GABA receptors and decreases the amount of serotonin in your brain. Someone may use more or less depending on their levels of chemicals in their brain. The environment can also have an effect. For example, if someone is in a stressful environment, they may be more inclined to take Valium to decrease their anxiety. There are psychological factors that also increase a user's risk of addiction. Many people who get addicted to other substances take Valium to enhance positive effects or decrease negative effects of the second drug.
Most people on Valium are prescribed by a doctor. Doctors wrote 14.7 million prescriptions for Valium in 2011. Admissions for benzo treatments such as Valium tripled between 1998 and 2008. The University of Michigan carried out a study in 2008 and determined that by 12th grade, almost 15% of students have tried either Valium, Oxycontin, or Vicodin for non-medical use. The number of opioid and other prescription-related deaths stood at 19,800 in 2009, almost in a perfect parallel with the prescriptions sold. Half of those prescribed with Valium abuse it or face addiction after 3 months of continued use. Generally, about 6.2 million Americans reported abusing prescription drugs in 2010, 31% of which used tranquilizers and 7% used sedatives. In 2013, there were approximately 1.2 million people abusing benzos such as Valium for the first time. Valium is frequently moved to the illicit market, with over 6,500 reports of the substance to forensic laboratories in the U.S. during 2011. Before 2011, the Drug Abuse Warning Network reported 345,000 emergency room visits were related to benzodiazepines such as Valium. Many of these were in combination with alcohol. Prescription painkillers are responsible for 36,000 fatal overdoses, surpassing deaths contributed to both heroin and cocaine. The National Institute on Drug Abuse reports in 2014 show that 4.7% of high school seniors had used some type of tranquilizer for recreational purposes during that year, and 7.4% of them had abused these substances in their lifetime. Most people who abused Valium as a teen used it in hopes to relieve stress or anxiety. The trends show that Valium use increases as students improve in grades, and parents or guardians are often unaware of the abuse.
Every day, the streets of New Orleans test Dr. Lee's faith in medicine. Melvin Woods took some street Valium. Now his face has frozen in a smile.
It's not really Valium. There's a medicine that the psychiatric patients get in the hospital. It's called Haldol, and it looks just like Valium. And this is what happens when you take it. My main advice to you is to stay away from that street Valium. It's not very good stuff. He told me that he took some sort of over-the-counter street medication, which he bought illicitly from what we call a non-licensed pharmaceutical representative.